Hi, everyone. Welcome to my channel. I am Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome. If you're new to my channel, make sure you subscribe. If you're not new and you are a regular to my channel and you're not yet subscribed, what are you waiting for? Make sure you subscribe as well. And make sure all of you, if you're not yet following me on Instagram, follow me on Instagram. Link is below. Support me as your ally, help me amplify my voice and amplify my reach with all of the content that I produce. So go ahead and follow me. It's really important to support your allies, especially right now. We need more people who are professional and objective and clear in their speaking and in their discussions of gender dysphoria and transgender issues. Having said that, today's topic that I'm going to tackle for all of you is it possible for gender dysphoria to suddenly disappear? Drum roll. The answer is yes. Before all of you are going to freak out, thinking about what the heck am I possibly talking about, especially those of you watching who have been struggling with gender dysphoria for decades and decades and decades. Now, hearing me say that it is possible for gender dysphoria to one day disappear, stay tuned and listen all the way to the end. First, what is gender dysphoria? Gender dysphoria is a psychological distress. It is a symptom cluster of symptoms that communicates to you psychologically a distress that you experience as a byproduct of disalignment, as a byproduct of tension you might feel, or as a byproduct of discomfort you may experience in regards to your gender assigned at birth. All it is a distress. Distress could be wrapped up in social aspects of dysphoria. It could be wrapped up in physical aspects of dysphoria. It could be wrapped up in combination of social and physical. For individuals, such as majority of my viewers that had onset of gender dysphoria in childhood, where you knew you just felt the strong disalignment since the age 4 or a little bit older, and you just strongly felt neurologically that your brain was of an opposite gender. For a lot of you, gender dysphoria has been present and stable throughout your lifetime until you actually did something about it, and that would be oftentimes for a lot of you transition. For a lot of other individuals, your onset when your gender dysphoria bubbled up could have been in pre-puberty or post-puberty or in your earlier adulthood. And for some of you, it might be at an older age. Distress can happen at any point, at any time. So when I say, what do I mean gender dysphoria suddenly can disappear? For whom it can suddenly disappear? What the heck am I talking about? Because a lot of people I work with do ask me, is it possible for this one day to just suddenly go away? Because a lot of people don't want to transition. A lot of people don't want to identify as transgender. A lot of people don't want to do all of the steps that are involved in living your life, presenting and living your life in that relationship to the gender other than gender you are assigned at birth. Yes, it is possible for dysphoria to disappear, but let's be super, super clear. And I want all of you to listen up to me right now. It is possible for dysphoria to disappear. However, the dysphoria disappears for individuals for whom the root issue that caused the gender dysphoria to start with was never, and had nothing to do with your gender identity. Let me repeat this. For those individuals for whom dysphoria disappears, it disappears because it initially was caused by other things, and I will tell you what those other things are, other than the root issue, gender identity. This is the most important thing, because here's the thing, having gender dysphoria does not equal one is automatically transgender. Anybody can experience gender dysphoria, and most people do experience gender dysphoria on and off periodically. Okay, because all it is a symptom. But what is the root of the symptom? This is why you often hear me say that you have to look at the root cause, and the root cause has to be tied to some kind of conflict with inner gender identity. Let me give you a classic example. A cisgender woman that feels comfortable with her gender assigned at birth, grows up and doesn't feel comfortable that a role or what it is to be a woman in today's society is being projected onto her. She doesn't like that people expect her to have kids, to marry, to be nurturing, to not be so career oriented, to not be so go getter. She despises the fact that people tell her that she needs to wear feminine clothes and be feminine and pretty and cute. So, in other words, she's experiencing a conflict between her sense of self and social expectation, stereotypical in this case, social expectation of gender roles. This woman will start experiencing gender dysphoria, all the while still feeling comfortable with her gender assigned at birth. Her dysphoria is going to be tied to the inner conflict between, hey, I'm a woman, but all of this are being projected on me and I'm not comfortable following all of those things. So the goal for this type of woman would be, because her root issue is not tied to her gender identity. Her gender identity as a woman is stable and grounded and anchored. For her, her goal is going to be to find a way to express herself and to find a way to not allow all of the societal projections and stuff to affect how she perceives herself. Do you see what I'm talking about? So for this woman, once she finds a way to navigate herself and once she finds a way to let go of all of these projections and to learn how to not to take them into her sense of self, how not to interject them and how not to let them affect how she navigates her life, the distress is going to go away. The dysphoria is going to suddenly disappear. Let me give you another example of when gender dysphoria can suddenly disappear and has nothing to do with transidency because that was never a root issue. Another example would be, for example, somebody who had severe sexual trauma. Now, when we experience severe sexual trauma, it's a trauma that has to do with violation and boundary crossing in regards to our physical selves, in regards to our physical body. Sexual trauma causes on body parts that are gendered. And as a result, for individual who has not healed their sexual trauma, they will carry wounding in regards to those physical aspects of self. As a result, they will develop physical aspects of dysphoria where they will not feel comfortable. They will feel tension. They will feel discomfort. They will feel disalignment with those body parts. Sometimes they may even want to get rid of those body parts. But again, because the root issue is not gender identity, these individuals will still feel comfortable in their core gender identity that was assigned at birth, but they just won't feel comfortable with those physical aspects of self and they will just want to get rid of them. Or they may just want to hide them. A lot of times there's very common for individuals with sexual trauma to also have history of eating disorder, for example, because you're either trying to put on weight in order to hide all those secondary characteristics about yourself, or you're trying to lose tremendous amount of weight so that way you become completely invisible to the world. And so this individual is going to come and express gender dysphoria, but the root issue here is sexual trauma. Once you heal and work on healing trauma and healing the wounding to the physical aspects of self, and help that individual process and establish and relearn and reestablish a new relationship to their body, gender dysphoria goes away. It disappears, so to speak. It doesn't exactly disappear, but it goes away. And it goes away because the root issue is not gender identity. For individuals, for majority of you who are watching this, your root issue, as I know this because I follow your comments, is tied to your gender identity. It is the gender that are assigned at birth that you're deeply uncomfortable with, or aspects of it that you're deeply uncomfortable with, that is causing gender dysphoria. For that reason, gender dysphoria can't just simply disappear because your root issue is actually your overall what I call it, container, your overall vessel through which you navigate this world. And that's why for individuals for whom gender dysphoria stems from a root issue tied to gender identity, it never disappears in my experience. It changes throughout your lifetime. It may change from being very severe to being more mild, depending how your coping skills develop, depending whether you become really good at coping. You may feel less distressed because you accepted that you have gender dysphoria, you accepted that you are transgender, and you're not yet ready to do anything about it. All of those factors will influence to what extent gender dysphoria is going to bother you, but it's going to be there. It's going to be there. It's just going to negate you to a lesser or greater degree, depending on not only your coping, but also your support system and a whole bunch of things, right? But again, it's going to be there. And those of you who have gender dysphoria tied to gender identity root issue know that it is there. It doesn't just disappear. It does go away if you take steps to fix whatever it is that's causing that disalignment, whatever it is that's giving you so much distress. This is why gender affirming care for a lot of people works, because you're modifying those characteristics that are so strongly in disalignment with your authentic sense of self. This is why other things also work. This is why hormones also work. This is why socially expressing yourself also work. And when we step into any of those transition related services, we start feeling alleviated sense of distress. For some people, when they even go through the whole gender transition, dysphoria still maintains to a lesser or greater degree, but it becomes much less painful. And the reason why it still maintains is because you still live in a world where people are constantly bringing up transgender identities, where there's governments and people who are trying to pretty much eradicate your existence by making policies who try to regulate your body. So you are constantly bombarded and you're going to feel the societal distress. And so no matter how good you feel about yourself, if you're stepping out to the world and you carry a perception, a feeling given to you by the world that the world is not welcoming, that they don't welcome you, you're going to feel discomfort about yourself. Hence, still some element of dysphoria post-transition. For some people, dysphoria completely goes away. But it goes away because you took some steps. It doesn't just disappear by sitting around and doing nothing, because if you sit around and do nothing, the incongruency is still present. If you sit around and you don't even acknowledge it, the distress is going to be there. The distress doesn't go off by itself. The distress, in fact, becomes even more drastic and starts affecting your physical health. And a lot of you know exactly what I'm talking about. So, yes, in a nutshell, gender dysphoria does disappear, but it disappears for individuals for whom it was never ever related to gender identity root issue. And it's a very big difference here to look at. So it's really important to understand that. It's also really important to understand that having gender dysphoria does not automatically mean you are transgender, because we have seen cis people can have gender dysphoria and oftentimes do. In fact, look, nobody is ever 1,000% comfortable in their gender, ever. It's impossible. It doesn't exist, because we're constantly inundated by social constructs, social ideas, social stereotypes, social pressures, social ways to conform to be a particular way in regards to what people perceive to be particular genders. So nobody is ever feels completely comfortable. There's always an element of discomfort. And for a lot of people, that element of discomfort is gender dysphoria. But again, it's not tied to a root issue of gender identity. The gender identity is stable. It's like, for me, I identify as a woman and I'm very comfortable with my gender assigned at birth. But sometimes I can feel distress. Would I qualify it as dysphoria? Yes. But my dysphoria is transient and it passes on. That's another thing, is for a lot of these individuals, it's kind of comes and goes and waivers, unless, of course, you do have history of severe abuse or trauma, then the dysphoria might be more present. But we're looking at the root issue. What is the root issue? So if you're sitting there wondering, I have gender dysphoria, does it mean that I'm transgender? The automatic answer is it does not mean that you're transgender, but it also does not mean that you're not. It means you have to look and examine what is the root issue, what is causing you to have the distress. It's the root issue that is going to shed the light on whether or not you have any kind of gender conflict issues that need to be resolved. And then you get an understanding to what extent the resolution is going to follow. Comment below, let me know what your thoughts are. Have your gender dysphoria suddenly disappeared? And if so, what was the root cause issue? And I will see you all next time. Bye.